Carl Sagan once said, "Advances in medicine and agriculture have saved vastly more lives than have been lost in all the wars in history." This is largely down to the technological advances in healthcare and medicine in the last 100 or so years. In the last century, technology and medicine have become increasingly integrated, with the X-ray machine's invention in 1895 and the development of the CAT and MRI scanners in 1971 and 1981 respectively. However, many do not understand the differences between MRI and CAT scans, their uses and effects on patients, and so I pose to you the question of what are the relative pros and cons of CAT and MRI scanners? An MRI scanner works by using magnetic fields to align the protons of a patient. Then non-harmful radio waves are projected at the patient to knock these protons out of alignment. When they realign, they send a radio wave back towards a machine, which receives the radio wave. From this, they can work out the position of the protons in the patient's body, and from this produce a 3D image of the patient's body used for diagnosis. A CAT scanner, however, uses X-rays revolving around the patient to create a 2D slice of the patient's body. These slices can then be put together to create a 3D image, which is also used for diagnosis. These technologies were both disruptive, as many changes were made when they were introduced. Before CAT scans, X-ray machines could only show 2D images of the patient, as opposed to 3D images which a CAT scan can produce, allowing for more detailed and accurate analysis and diagnosis. Also, CAT scans and X-ray machines could not produce detailed images of certain soft tissues in the body, for example ligaments and tendons, whereas MRI scans can produce detailed images of these areas, which can be used for diagnosis in problems in said areas. An advantage of CAT scans is that they are much quicker at scanning patients, usually only taking 5 minutes, as opposed to an MRI scan taking anywhere from 10 minutes to 2 hours depending on the scan. Because of this, in an emergency, CAT scans are much better. A lot of times, patients will have a CAT scan for quickness than an MRI scan for more details. CAT scans are also much better at imaging bones and cartilage, and so will be preferred when diagnosing problems with these. However, CAT scans use X-rays which can be harmful and so are not always appropriate in the case of children or pregnant women especially, or in particular body parts such as breasts. This makes MRI scans preferable in some of these cases. Another advantage of MRI is that small changes can easily be made in the magnetic field or the radio waves to change the contrast and highlight certain areas of the body for higher detailed images, such as highlighting a tumour in the brain. So ultimately, it very much depends on the circumstances as to which scan is better, depending on what the ailment is and how urgent it is. Professionals do their best to decide which scan is appropriate.